Hey everybody, today we're going to go over how to set up a patient-controlled analgesic using the Alaris IV pumps. Just a few key points to remember when a patient is on an IV PCA. Only hold the IV PCA if the patient loses IV access, if the patient becomes confused or hemodynamically unstable, and also only the patient can press the buttons themselves. Also, be very careful with oral medications for pain and sedatives, as those can potentiate the patient from becoming lethargic. So let me start by showing you the pump itself. We have number one here, the actual module or the brain. Then we have the actual patient control analgesia PCU right here. And we must have another one, another PCU, so that we can set it up as a carrier. Also, the key, it's mandatory to open the PCA, and this is the little nunchuck that only the patient can use to press. First, we have our morphine PCA syringe over here. This is for training, so the whole thing is actually saline, but just to give you an idea. And this one's here in this institution, it will come in a 30 milliliter syringe like this. Once we have this, we have to get the actual PCA tubing. This is the tubing that we're going to use for our PCA. As you can see, this is where the syringe is going to attach to. And as you can see, right before it gets to the end, it's going to have two splits. Now the line that's already connected on it, this is where the syringe is going to go, and this is the part that's going to attach to the patient. The alternative one over here, this is where we're going to attach our normal saline as a carrier that is going to carry the PCA every time the patient press it. Okay, you can think about it as this is the river that continuously flows, and the PCA is a little paper boat that every time the patient press, you put a paper boat on the river and it carries it down to the patient. Next, we're going to attach our morphine to this end of the tubing. This little port over here is what we call the anti-siphon valve, and it prevents accidental free flow. So we're just going to push just a little bit to break the seal, because sometimes the pump has some difficult time pulling if we don't. Just a little bit right there. Okay, and next we're going to affix that into our pump. So you're going to use the key, go to the unlock position, as you can see. Okay, this part here is the clamp that we have to pull out, and this one comes up. Next, what you're going to do is this part of the syringe, this little bevel, it will go right there in between the gray spot there, and it will just sit in. Okay, once it sits inside, make sure this one goes back in, and this part open, and oops, you're gonna drop it down to the syringe right there. Okay, once that's done, we're just gonna close the door, and then you're going to lock it up. Another thing I wanted to show you is the little cord that comes attached to it. Please try not to detach it, as each one of them comes with one cord, but should you detach it, do not pull it from here because it will break. You can see the red dot to red dot, grab it from here and you pull out. And to reconnect, you do exactly the same thing. You just match it red dot to red dot and it goes back in. Next, we're going to start priming our PCA. Make sure that it is disconnected from your patient, right? And that is also clamped, okay? All right, next I have an order here. So we're going to set the PCA patient bolus of 0.2 milligrams of morphine with a lockout time of 5 minutes, a 4 hours dose limit of 10 milligrams, and a continuous rate of 0. So this is going to be our PCA settings that we're going to put into our pump. Next thing is you're going to turn on your Alaris pump by pressing the system on button and let the system reboot. Once the pump has rebooted, it's going to ask you if this is a new patient. So we're going to set up a brand new patient. So yes, in our hospital, we only care for adult patients. So we're going to put adults, yes. Next, we're going to select our PCA channel, which is right here. So you're going to select this channel, and it's going to automatically tell you that the key needs to be in the program position. Right now, it is in the lock position, right? So we're going to change it to this way. Once it's set to program, the pump itself is going to tell you if this is the correct time, and yes, this is the correct time right now. So we're going to click confirm. We only have these type of syringes in our organization, the BD plastic pack, the 50 or 60 cc's. So we're going to select that one. That's where our medication comes in. And in our example, we're doing morphine PCA. Also, we're doing the standard dose. So we're going to click standard, and this is the correct concentration, 150 milligrams in 30 milliliters. So we're going to click yes. It says that if we are going to set a max limit, which we have to, because this is one of the safety parameters for our patients. So we're going to click yes. All right, so this is the morphine PCA. The pump is telling you this is what I got so far. Are you sure you want to continue? We're going to click yes next. We only gonna do PCA only, okay? Not continuous infusion. PCA only means when the patient presses it, it's gonna deliver a dose. Otherwise, the saline carrier is just gonna run through the line, okay? So PCA dose only. And from our order, we say that the dose was 0.2 milligrams with a lockout interval of 5 minutes. This is all based on the example that I set up. The max limit that we have is, do you want to set a max limit? Yes. And it was 10 milligrams. Okay. That means that in 4 hours, we're limiting the patient and getting only 10 milligrams of morphine because it is a narcotic and it can cause hypotension and respiratory depression as well. Loading dose, we're going to leave it as a none. We're not going to do a loading dose. And we're going to click confirm. Once we click confirm, the pump is going to tell you that this is below the guardrail limits. Do you want to proceed? And because this is the example that I set up, we're just going to put yes, because this is the example that I want to use. Okay, it's going to ask you close and lock the door. So now that it is in programming, we're going to lock the door. Once it is locked, before you press start, remember that we still need to prime all this empty tubing that right now has air. We have to prime it with the morphine. So we're gonna go here in this little button that says options. It's not on the screen, it's right here, options, and we're gonna go to page down right here, okay? And you should see this option that says prime set with syringe. You're gonna press that, and then the pump is gonna tell you, please put it to the program. So we're gonna put it to the program, okay? And the pump will say it's ready to prime. So once it's ready to prime, we're just gonna press and hold the prime button. As we press the prime button in there, you should see that there will be the pump will be priming, and it will tell you how much it's actually priming in there. At this point, all you need to do is prime it until right here where you see the Y, okay? Right here until you see where the Y starts. Once we're done priming, we're gonna click exit, okay? And before we're ready to start, okay, we are going to set up a brand new carrier. All right, time to set up our carrier here. So we're gonna select channel, okay? Once you click select channel for this one, we're gonna go to our IV drug fluids, and we're gonna do IV fluid. This is what we call a carrier. That means that this is gonna be the minimum amount that is gonna run to continuously keep the vein open. And every time the patient presses the nunchuck here to deliver the PCA, this morphine will be thrown onto the carrier, and the carrier will slowly bring it in, because remember from our line, it is a Y line, right? So our rate, we're gonna put the very minimum that we can allow, which is 10. We're gonna select rate, and we're gonna put 10, right? In our volume, in our bag, I have 250 milliliters, just for this example. Once that's ready, we're going to connect it to the other end of our Y line, and now this line here is ready to connect to our patient. So we're gonna connect this line to our patient's PICC line, assuming the PICC line is working well and is patent. Just like that. And now we can click start. Once you click start, you're gonna see that the patient's gonna receive the 10 cc's of saline running in, and the PCA is active already. So every time when the patient presses, and let's have a look, when we press, you're gonna see this changes to PCA completed. So that means that the dose has been delivered to the patient already. And if the patient tries to press it again, nothing's gonna happen, because they need to wait 5 minutes. That's the 5-minute lockout time. This is to prevent patients from trying to accidentally giving themselves too much. Next, towards the end of your shift, if you want your pump needs to be clear up, so you go to volumes infused, and it will tell you how much it has been delivered to the patient. Okay, so once you can see, as you can see, channel A, which is this one here, our PCA, it has delivered a 0.04 milliliters of medication to the patient. If we click clear all, it will clear everything. Watch, but just be mindful that once you click clear everything, you cannot retrieve any of that information later, so be careful. Okay, so watch, volume to be infused, and at the end of our shift we're going to clear all of this because this is going to be part of our intake and output, and you can see it all went to 0. You cannot retrieve it, so make sure you write that information first. So let's say that our patient does not require the IV PCA anymore, so let's remove it. With an order to discontinue PCA, you're gonna put the pumps, pause the pumps first, okay? And the very first thing you're gonna do is you make sure you clamp this so the patient doesn't get any medication accidentally. You clamp that. Next, we're gonna remove our line from the PICC line, and once it's actually removed, you're going to flush it and heparin lock it to maintain patency. All right, now the line has been removed from our patient, let's disassemble our PCA. First and foremost, you can actually turn off the carrier channel. Now, to actually turn off the PCA and to remove the syringe, you still need the key. Okay, so we're gonna go to unlock. Okay, we put channel off. All right, we're gonna put channel off. Then you're gonna go to unlock, so this kind of opens up. Once it has been opened up, make sure that everything is clamped in the line, but we already removed this line from our patient to avoid accidental delivery. So you're going to pull this part out. This one pulls up, and the syringe just comes right up like this. If you have any medication in here that is left, it must be co-signed and wasted with another nurse or another licensed professional. One more point, this we have to make sure that goes back in, and also this is the little lever needed if you want to detach this from the pump. Watch, when I press down, and this one is protected by the cover so that patients don't remove them themselves. Okay, once you press, the whole thing can detach, as you can see. Okay, so this is how you will detach it from the actual module themselves. And that's how you set up an IV PCA for the Alaris pumps. Bye for now.